Wow, now I'm pregnant. What do I do when I have implantation bleeding? What actually are the 3 trimesters of pregnancy? What should I eat when I am pregnant, especially in the early stages that I'm always vomiting and being nauseated? And why does my bladder feel full all the time? So we're gonna delve into all this in this episode of Motherhood series Nursing with Abby. So stay tuned. Alright, so my name is Abiodun and you're welcome to another motherhood series of Nursing with Abby. So today we are going to be talking about last episode. Yes, for those who joined me in the last episode, if you didn't, you missed out, but don't worry, I'll drop the link in the description box so that you can catch up. So we talked about introduction, why my body has to change, and implantation bleeding. So I'm going to kick up from there today. I'm going to be talking about what to do when you have that implantation bleeding I talked to you about, the 3 trimesters of pregnancy, what to eat, especially when you're early in pregnancy, and why your bladder feels full, and what to do to prevent urinary tract infections. So it's a full package. So let's just delve right into it. But before I go into it, I'd like to thank all of my subscribers for always supporting this channel. I can see your love, I can see your support, and I do not take it for granted. I thank you. Please always make sure that you like, share, and subscribe. You actually might not be pregnant or think of getting pregnant, but please, somebody near you does. So just throw the link to the person. Just tell the person, oh, you need to watch this series, you need to watch this episode, you need to watch this channel to help you have a seamless pregnancy and a safe delivery, because we're going to be covering all that in this motherhood series. And for those who are just being in my face for the first time, seeing me for the first time, you're welcome. I'd like you to do 4 things for me right now. I'd love you to like this channel. That's number 1. I'd love you to share to your friends who it might be of advantage to. I'd love you to subscribe. Please subscribe. It will support us to do more on this channel. And the last thing is that I'd love to see your comments. I'd love to see it. I'd love to read it. I'll be so elated reading your comments. All right. Thank you so much for doing that for me. All right. So like I said, my name is Nurse Abby Abiodun, full name. I have talked about nursing, I talk about lifestyle, and everything in between, which is motherhood is something in between, yeah? So today I'm going to be talking about what to do about when you're having implantation bleeding. Now, like I said, implantation bleeding is that period when your baby, those clump of cells, are trying to embed or come or attach to the wall of your uterus just to stay there and then grow into a baby. So at that moment, when something is trying to attach, it might take a little bit of difficulty here and there, which there's really nothing you can do about it. But there's actually something you could do about it, and that is rest. At that period, you need to rest. You could even have some time off sex. Yes, you could have some time off sex. So just ask your partner to cooperate with you so that your baby implants well and okay, because it's a kind of risky period for that clump of cells to actually implant and attach well. So try and give yourself a lot of rest. Try and give yourself a lot of emotional joy. Yes, just feel and love being happy. Okay, then you try as much as possible, yes, to prevent sex. Take a lot of water and eat balanced diet. Yes, eat well, because the more you eat, the more the baby receives from you, and the more the baby is healthy and you're also healthy. So that's what to do in implantation bleeding. Remember, I told you that implantation bleeding should not be so much like your menstruation. It should not be long in duration. It should not take days on end bleeding. If you notice any bleeding that is so much that you have to change your pad or your pad like 2-3 times in a day, and you're pregnant, please, you need to visit the doctor as soon as possible. That's not implantation bleeding again. You're already bleeding in pregnancy, and that needs medical attention. Okay, and if it's longer than the regular 2-3 days, you also need to see a doctor. Let them run an ultrasound scan on you and see what's going on down there. So that's what you do in implantation bleeding. Now, we have 3 trimesters in pregnancy. Oh, what's trimester now? Yeah, don't worry. I'll break it down for you. Trimesters are just stages or phases in pregnancy. We have the first trimester, the first stage, second trimester, second stage, and third trimester, third stage. So the first trimester is actually the first stage that a lot of people don't really know you're pregnant. A lot of people don't really know what's happening to you inside there. They don't really understand why you're taking some time off work. They don't understand why you keep sleeping every day. You feel dizzy, you feel a bit pale, and all that. Now, that is the first stage that a lot of people don't know because there's no obvious sign that you're pregnant, that your belly is still like flat and not yet bulging out for people to see. That's the first stage, and that's about the stage that the baby is trying to acclimatize to your body system, is trying to grow, and that's the time that your baby actually forms in your womb. That's actually the time the baby forms. The first 3 months, the time the baby forms. Now, the second 3 months, which is the second trimester, or second phase or stage, as you would call it, is the stage when the baby has already acclimatized herself or himself with the environment of your womb, and the baby is now trying to grow. Yes, the baby is trying to grow. Now, your own body system is now the one acting now. The body system is now the one that has to supply a lot of food, a lot of water, a lot of nutrients to the baby to blossom and grow into the healthy baby that you long for. That's second stage. Now, the third stage, at this second to third stage, people already can see that you're pregnant. You can imagine somebody seeing a fully pregnant and say, "Yeah, are you pregnant?" That's a question. Come on. So at that point, your belly is already bulging. Everybody's already seeing that you're different. Everybody can see the change in your walking. They can see the change in your face, maybe a bit puffy. You feel a bit bigger than usual. Your tummy is big. You feel a bit cranky. You eat a lot. Yeah, those are the things that they see in the third stage. And at that third stage is when you start having the nurturing spirit of, yes, I'm going to be a mother pretty soon. Yes, that's a beautiful, beautiful period, I must say. And then we have like those 3 stages. We're going to be delving into them one after the other. You remember I told you that this series is for 6 months. I'm going to be doing it twice in a week. So please make sure you always follow the channel. All right. So we delve into diet in pregnancy. Yes, early pregnancy. That's what I want to talk about. Diet in early pregnancy. Now, I understand and realize that a lot of people during this early period of the pregnancy, the first trimester, start going through the early pregnancy symptoms. They start going through the pregnancy symptoms. They start feeling nauseated. They start feeling like vomiting. They start feeling weak and tired. They start feeling like longing to sleep. They don't even feel have appetite to eat. And they're wondering, how do I cope? Because my doctor told me or tells me that it's what I eat the baby would eat. There's no how the baby can eat without me eating. And I don't feel like eating. So what do I do? Okay. So let's break it down. Now, remember I told you that we have estrogen and progesterone, which are very, 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 very vital for the growth of your baby. Now, those estrogen and progesterone are those that gives you those symptoms of feeling nauseated and feeling tired and all that. Now, what do we do? And the initial stage, okay, when you wake up in the morning, don't just grab up like that. Don't just get up like that, okay? Your body just needs some time to, let me call it, in a way, boots. Yes, it needs some time to reset. Always have dry crackers, yes, like those dry biscuits. Some will call it cabin biscuits, some will call it the cracker biscuit, whichever one. Always have it by your side, and always have a fruit juice by your side. It could be the natural one, it could be the processed one. Now, before you get up from bed, don't worry about washing your mouth. Don't worry, it's you and yourself, okay? So just take some dry crackers in your mouth. Take a little sip of the juice, okay? Maybe you just take like 1 wrapper or 4 pieces or something. So let your body take in that. Now, as your body takes in that, your body realizes there's increase in glucose in your body system, and then the hormones are diverted away from that nauseated feeling, and then at least you feel a bit better. Then you rise up from bed gradually. Okay, and then the initial things that you do in the morning might be a little bit, don't rush into things, okay? And then try to make sure that you take things that you can tolerate. If you notice that the foods that you can tolerate at that moment could be maybe something that is not too spicy, maybe a cup of tea and bread without milk, because some people get nauseated with milk, you could just take that at breakfast and then you go about your daily activities. So, and immediately you notice that you're a bit hungry around the 11 p.m. or 12 in the afternoon, then you must make sure that you have something in your bag that you can eat, most preferably fruits. Yes, that is very good. You could just cut some apples into slices and take them, with a toothpick. Okay, just take apples. You could take apples, pineapples, bananas, and all that. We are trying as much as possible to increase your glucose levels. As we are increasing your glucose levels, that's your sugar level, that's the amount of food that you eat. Remember, I've told you about something you're supposed to do in the morning. You took crackers and fruit juice, right? And by midday, or let me call it, yes, mid-morning, you've taken a snack, fruit snack. You've not taken breakfast. You probably might not feel like taking breakfast, but you might take maybe bread and tea if you can. But by that time you take the fruit juice, you would notice that you feel a bit better to take a sumptuous lunch. And then you can, take something a bit light also when you're taking your dinner. Now, all you just need to do is study yourself. I think that is just the most important thing. Study yourself and see what goes on well. So now the fourth and the final thing I'm going to talk about is bladder fullness. Now, you notice during this first trimester of pregnancy that your bladder is always full. That's the place your urine is stored. After using the restroom for a bit, you just feel like you want to go there again. Now, what happens is where your uterus is to where your bladder is, they're so close to each other. And because your baby is growing inside that pelvic cavity, that's in your waist area. So as the baby is growing, it's also applying a lot of pressure on that bladder. And that's why you always feel your bladder is full every time. So what do? Do you just ignore it? Do you just prevent it? Do you just avoid it completely? No, that's not a good thing. Try and always make sure that you empty your bladder. It is very good to help your baby. It's very good to help your urinary system. It's very good to help your whole body system. Okay, the more you urinate, the more you throw out all those waste particles, and then you can be healthy. Okay, and your baby also, it's bringing out a lot of waste from itself. So definitely you're going to be having more waste, and then because of the weight of your baby as against the bladder, it's going to be getting full all the time. But make sure to prevent infection. You always make sure that you take a lot of water, and also make sure that you empty your bladder every time. Make sure that every time you empty your bladder, because if you keep a lot of urine in there, bacteria store in there, infection can come in, and then we'll start managing something else. Okay, and we want healthy baby and healthy mother. Remember, that's our goal: healthy baby, healthy mother. So with all this, I hope I've been able to do something about what to do in implantation bleeding. I told you a lot on rest, what to do in the three trimesters of pregnancy, first, second, and third. And then we talked about diet in early pregnancy, especially when you wake up in the morning, and how you can stretch your meals to be small, frequent meals regularly throughout the day. And then bladder fullness and how to prevent the risk of urinary tract infection. So till I see you in my next episode, we're going to be doing another one next week. So from me, it's bye for now.